Hello and welcome. I'm YCY, and today we have something exciting to share with you. Let's dive right in. In the complex universe of the human body, vitamins play the role of silent heroes. They don't directly provide energy like carbohydrates, proteins, or fats, but they are essential catalysts involved in thousands of biochemical reactions, maintaining every living activity from simple to complex. From converting food into energy, building and repairing cells, protecting the body from illness, to ensuring the smooth function of the nervous system and vision all require the presence of various vitamins. However, our bodies cannot synthesize most vitamins on their own, with some exceptions like vitamin D under sunlight or vitamin K by gut bacteria. Therefore, we must rely on daily dietary intake for our supply. When the amount of vitamins consumed is insufficient to meet the body's needs, a state of vitamin deficiency occurs. It's worth noting that vitamin deficiencies often develop silently in the early stages, with signs that are unclear or easily mistaken for other health issues. Only when the deficiency becomes severe does the body begin to send more obvious warning signals. Recognizing these signs early is crucial for timely dietary adjustments or considering supplementation to prevent long-term health consequences. To understand why vitamin deficiencies cause serious health problems, we need to review their diverse roles: energy metabolism, B vitamins, B1, B2, B3, B5, B6, B7, B12, are indispensable keys in the process of converting carbohydrates, proteins, and fats from food into energy that the body uses. Deficiency in these vitamins can lead to fatigue and weakness, immune system function, vitamin C, vitamin D, vitamin E, vitamin A, and some B vitamins play significant roles in boosting resistance, supporting the activity of immune cells, helping the body fight infections. Bone health. Vitamin D is a key factor in helping the body absorb calcium and phosphorus, two essential minerals for bone development and strength maintenance. Vitamin K also participates in bone mineralization. Eye health. Vitamin A is a component of rhodopsin, a light-sensitive pigment in the retina, necessary for vision, especially the ability to see in low light conditions. Skin, hair, and nail health. Vitamin C is necessary for the synthesis of collagen, a crucial structural protein in the skin. Biotin, vitamin B7, is often known for its role in supporting hair and nail health. Vitamin E is an antioxidant that protects the skin. Nerve function. B vitamins, particularly B6, B12, and folate, B9, play essential roles in producing neurotransmitters, forming the myelin sheath that protects nerve fibers, and maintaining overall nervous system health. Blood clotting. Vitamin K is an essential factor in the synthesis of blood clotting factors in the liver, helping to prevent excessive bleeding when injured. Antioxidant. Vitamin C, vitamin E, and carotenoids, precursors of vitamin A, act as antioxidants, helping to protect cells from damage caused by free radicals, slowing down the aging process, and reducing the risk of chronic diseases. When the body doesn't receive enough of these heroes, essential functions decline, leading to a series of warning symptoms. It's important to note that these symptoms can overlap and may be caused by many factors other than vitamin deficiency. Therefore, consulting a healthcare professional is necessary for an accurate diagnosis. Chronic fatigue and weakness. Related to deficiency in vitamin B12, vitamin B9, vitamin B1, vitamin D, vitamin C. Description: persistent feeling of low energy, even with sufficient sleep. The body feels heavy, making it difficult to perform daily activities. This state does not improve with rest. Explanation: B vitamins are central to the process of converting food into energy. Their deficiency reduces the efficiency of cellular energy production. Vitamins B12 and folate are necessary for the formation of healthy red blood cells, which transport oxygen throughout the body. Deficiency in these two can cause megaloblastic anemia, leading to fatigue because cells don't receive enough oxygen. Vitamin D is also linked to energy levels and muscle function. Vitamin D deficiency can cause muscle pain and fatigue. Vitamin C is necessary for the synthesis of carnitine, a molecule important for energy production, and it also helps absorb iron, preventing iron deficiency anemia, another cause of fatigue. Skin and hair problems. Related to deficiency in vitamin A, vitamin C, vitamin E, biotin, vitamin B7, riboflavin, vitamin B2, niacin, vitamin B3. Description: dry, rough skin, acne, especially skin on the arms and thighs can feel rough like chicken skin, keratosis pilaris. Slow wound healing, cuts, scrapes, or bruises take longer than usual to recover. Dermatitis, rash, skin around the mouth, nose, and eyes can become inflamed, red, and flaky. Dry, brittle hair that easily breaks or falls out, hair loses its shine, becomes dry and more prone to breakage and loss than usual. Explanation: vitamin A is necessary for the growth and repair of skin cells. Vitamin A deficiency reduces skin cell regeneration capacity, causing dryness and roughness. Vitamin C is key to collagen synthesis, which helps skin elasticity and promotes wound healing. Deficiency in C impairs this ability. Vitamin E is an antioxidant that protects skin cells from damage. Biotin, B7, is known for its role in hair and nail health, though severe biotin deficiency is quite rare. Riboflavin, B2, and niacin, B3, are B vitamins necessary for skin and mucous membrane health. Deficiency can cause dermatitis and cracked mouth corners. Mouth and gum problems. Related to deficiency in vitamin C, riboflavin, vitamin B2, niacin, vitamin B3, folate, vitamin B9, vitamin B12. Description: bleeding gums. Gums are swollen, red, and bleed easily even with gentle brushing. Cracked mouth corners, painful cracks at the corners of the mouth. Swollen, smooth tongue. The tongue is swollen, red, and shiny, potentially causing pain when eating or drinking. Mouth ulcers, small white or yellow sores with red borders inside the mouth. Vitamin C deficiency causes scurvy, one of the typical symptoms being bleeding gums due to C's role in collagen synthesis, the supporting structure of gum tissue. Deficiency in riboflavin, B2, and niacin, B3, can cause inflammation and cracking at the corners of the mouth, and glossitis. Deficiency in folate, B9, and B12 affects the rapid growth of oral mucosal cells, leading to glossitis and mouth ulcers. Eye problems. Related to deficiency in vitamin A, riboflavin, vitamin B2. Night blindness, difficulty seeing clearly in the dark or when moving from bright to dark environments. Dry eyes, gritty feeling, eyes lack moisture, feeling gritty or uncomfortable. Conjunctivitis, corneal damage. More severe vitamin A deficiency can cause structural damage to the eyes. Vitamin A is necessary for the formation of the visual pigment rhodopsin in the retina. Deficiency in A reduces the ability to regenerate rhodopsin, causing difficulty seeing in low light conditions. Vitamin A deficiency also affects tear production, causing dry eyes. Riboflavin, B2, also plays a role in eye health. Deficiency in B2 can cause light sensitivity and conjunctivitis. 2.5. Bone and joint pain, muscle weakness. Related to deficiency in vitamin D, vitamin K, vitamin C, bone pain, joint pain, dull ache or throbbing pain in the bones, especially long bones in the legs, back, and pelvis. Muscle weakness, muscle aches, difficulty standing up from a squatting position, slow walking, feeling of lack of strength in muscles. Vitamin D is essential for absorbing calcium and phosphorus from the intestines into the blood. Deficiency in D reduces calcium levels, forcing the body to draw calcium from bones, causing soft bones, osteoporosis in adults, rickets in children, leading to pain. Vitamin D also directly affects muscle function. Vitamin K participates in the process of binding calcium to the bone matrix. Deficiency in K can affect bone strength. Vitamin C is needed for collagen synthesis, a structural component of cartilage and connective tissue in joints. Nervous system issues. Related to deficiency in vitamin B12, thiamine, vitamin B1, pyridoxine, vitamin B6. Numbness, tingling in hands and feet, feeling of crawling, prickling, or loss of sensation in the limbs. Difficulty walking, balance problems, feeling unsteady, prone to stumbling. Memory loss, difficulty concentrating, mood changes, difficulty remembering, slow thinking, irritability or depression. Tremors in hands and feet, less common involuntary movements. Vitamin B12 is very important for nervous system health. It is necessary for the formation of the myelin sheath around nerve fibers and the synthesis of neurotransmitters. B12 deficiency causes damage to nerve fibers, leading to numbness, weakness, and cognitive problems. Thiamine, B1, is also necessary for nerve function. B1 deficiency causes beriberi with neurological symptoms. Vitamin B6 also participates in neurotransmitter production. Severe B6 deficiency can cause peripheral neuropathy, easy bruising and poor blood clotting. Related to deficiency in vitamin C, vitamin K, easy bruising, even minor impacts cause large bruises. Bleeding gums, gums bleed easily. Frequent nosebleeds, with no apparent reason. Slow wound clotting, when cut or injured, blood takes longer to stop flowing. Vitamin C is needed for the strength of blood vessel walls, through collagen synthesis. Deficiency in C weakens blood vessels, making them fragile and prone to rupture, causing bruising and bleeding. Vitamin K is an essential factor in the synthesis of blood clotting factors in the liver. Deficiency in K disrupts the clotting process, leading to bleeding that is difficult to stop. Loss of appetite, unexplained weight loss. Related to deficiency in thiamine, vitamin B1. Loss of appetite, eating less than usual, leading to unintended weight loss. Thiamine, vitamin B1, plays an important role in carbohydrate metabolism and stimulating appetite. Thiamine deficiency can affect the digestive and nervous systems, leading to loss of appetite, nausea, and weight loss. Shortness of breath, rapid heart rate. Related to deficiency in thiamine, vitamin B1, wet beriberi, severe B12 folate deficiency, severe anemia, feeling breathless, difficulty breathing during exertion or even at rest. Rapid heart rate, palpitations. Severe thiamine deficiency can affect the cardiovascular system, causing heart failure and edema, wet beriberi, leading to shortness of breath. Severe anemia due to B12 or folate deficiency reduces the blood's oxygen carrying capacity, forcing the heart to work harder to compensate, causing rapid heart rate and shortness of breath. When do signs become important? Observing your body is the first step. However, as emphasized, many symptoms can have other causes. You should pay special attention and seek medical advice if symptoms persist, do not improve, or worsen. Symptoms significantly affect your daily quality of life. You have high risk factors for vitamin deficiency, strict diets, digestive diseases, alcoholism, use of certain medications, older adults, pregnant or breastfeeding women. You experience multiple symptoms simultaneously. Your doctor will evaluate your medical history, conduct a physical examination, and may order blood tests to check vitamin levels, thereby providing an accurate diagnosis and appropriate treatment plan. How to supplement vitamins correctly. Prioritize food sources. This is the golden rule. A balanced, diverse diet full of various food groups is always the best way to provide vitamins and minerals to the body. Food not only provides vitamins but also contains fiber, antioxidants, and other beneficial plant compounds that work synergistically, offering comprehensive health benefits that supplements can hardly replace. Vitamin A, liver, fatty fish, eggs, milk, dark leafy green vegetables, spinach, kale, orange, yellow root vegetables, fruits, carrots, pumpkin, sweet potatoes, mangoes, papaya. B vitamins, B1, whole grains, pork, fish, lentils, sunflower seeds. B2, milk, yogurt, cheese, beef, fish, dark leafy green vegetables, almonds. B3, chicken, tuna, salmon, beef, peanuts, mushrooms, whole grains. B5, found in most foods, especially mushrooms, avocados, broccoli, sweet potatoes, whole grains. B6, salmon, chicken, potatoes, bananas, spinach, walnuts. B7, cooked eggs, salmon, pork, sweet potatoes, almonds. B9, dark leafy green vegetables, spinach, collard greens, lentils, peas, asparagus, oranges, fortified grains. B12, found only in animal products, meat, fish, eggs, dairy, and fortified foods, cereals, plant-based milk, nutritional yeast. Vitamin C, citrus fruits, oranges, lemons, strawberries, kiwi, bell peppers, red, yellow, broccoli, tomatoes. Vitamin D, fatty fish, salmon, mackerel, fish liver oil, egg yolks, fortified foods, milk, orange juice, cereals. Most importantly, synthesized through the skin when exposed to sunlight, from 10 a.m. to 3 p.m., about 10 to 15 minutes a day, depending on geography, weather, skin tone. Vitamin E, sunflower seeds, almonds, peanuts, spinach, broccoli, vegetable oils, sunflower oil, wheat germ oil. Vitamin K, dark leafy green vegetables, spinach, kale, vegetable oils, some meats. To ensure sufficient vitamins from food, eat a variety of fruits and vegetables of different colors. Choose whole grains over refined grains. Include enough protein from various sources, lean meat, fish, eggs, beans, nuts. Use healthy vegetable oils. Limit processed foods, fast food, and sweets, as they are often poor in vitamins and minerals. When to consider vitamin supplements. Although diet is the best source, vitamin supplementation through pills may be necessary in some cases. Insufficient diet. People on very strict diets, e.g. vegans, need B12, D. Individuals with limited food intake due to illness or age, those with poor appetite. Increased needs. Pregnant and breastfeeding women need folate, iron, calcium, vitamin D. Growing children, if diet is insufficient. Older adults, poor absorption of B12, D. Poor absorption. Individuals with digestive diseases, like Crohn's, celiac, gastric intestinal surgery, alcoholics, people using certain medications that affect vitamin absorption, e.g. stomach acid reducers affecting B12. Limited sun exposure. People living in regions with little sunlight or who spend little time outdoors, especially need vitamin D. Diagnose deficiency. When blood tests confirm a deficiency in one or more vitamins. Guide to safe and effective supplementation. If you belong to a group that may need supplementation or have been diagnosed with a deficiency, follow these principles. Consult a healthcare professional. This is the most important step. A doctor or registered dietitian will assess your health status, diet, current medications, and the degree of deficiency, if tested, to advise on the type of vitamin to supplement, dosage, and duration of use. They can also advise on potential drug-vitamin interactions. Do not self-diagnose and do not self-administer high doses of any vitamin, especially fat-soluble vitamins, A, D, E, K. Choose quality products. Select products from reputable manufacturers with clear origins. Look for quality certifications if available. Adhere to recommended dosage. Do not exceed the recommended dietary allowance, RDA, or tolerable upper intake level, UL, unless prescribed by a doctor. High doses of some vitamins can be toxic, e.g. vitamin A causing liver damage, vitamin D causing high blood calcium, high-dose vitamin B6 causing neuropathy. Consider timing. Fat-soluble vitamins, A, D, E, K need to be absorbed with fat. Best taken with a meal containing some fat. Water-soluble vitamins, B vitamins, C can be taken any time of day, but often recommended with or after a meal to reduce the risk of gastrointestinal discomfort. B vitamins are often taken in the morning because they are related to energy metabolism. Be aware of interactions. Some vitamins can enhance the absorption of others, e.g. vitamin C helps increase iron absorption. Some vitamins can interfere with the absorption or activity of medications, e.g. vitamin K can affect the anticoagulant warfarin. High-dose vitamin B6 can affect Parkinson's disease medications. Other medications can also affect vitamin absorption. Always inform your doctor about all medications and supplements you are taking. Single versus multivitamin. If you are deficient in only one specific vitamin, supplementing just that type is sufficient. If your diet is very poor or you have multiple symptoms suggesting deficiencies in various vitamins, your doctor may recommend a multivitamin and mineral supplement. However, multivitamins often have lower doses and may not be sufficient to treat a severe deficiency of a specific vitamin. Be patient and monitor. Vitamin supplementation takes time to show effects, especially for chronic symptoms. Be patient and follow your doctor's guidance, scheduling regular follow-ups to monitor your condition and adjust the dosage if needed. Preventing vitamin deficiency. The best way to avoid vitamin deficiency is to proactively prevent it. Build a healthy, balanced diet, eat from all food groups, diversify your sources of vitamins and minerals. Don't skip meals, eat regular main meals and snacks to ensure sufficient nutrient intake. Limit junk food and processed foods, these often provide empty calories and are low in vitamins and minerals. Get appropriate sun exposure. Helps the body synthesize vitamin D, but avoid harsh sun and use sunscreen to protect your skin. Limit alcohol and smoking, they affect the body's ability to absorb and metabolize vitamins. Regular health checkups, helps detect potential underlying health issues early, including the risk of vitamin deficiency. Discuss your diet and lifestyle with your doctor. Conclusion. Our body is a marvelous machine, constantly trying to send warning signals when something is not right. Seemingly minor signs like fatigue, dry skin, cracked mouth corners, or tingling in hands and feet could be alarms, indicating vitamin deficiency. Essential nutrients for every living activity. Listening to your body, recognizing these signs early, and most importantly, seeking advice from healthcare professionals is a smart step to protect your health. A balanced, diverse diet from natural food sources is the strongest foundation. Vitamin supplementation through pills should only be considered when necessary, under the guidance and strict supervision of a doctor. View healthcare as a continuous journey, in which ensuring your body has enough vitamins is an indispensable part. By actively listening and taking appropriate action, we can help our bodies function optimally, maintain good health, and enjoy life more fully. Disclaimer: this article provides general information about vitamin deficiency signs and supplementation. The content is not a substitute for professional medical advice, diagnosis, or treatment. If you have any health symptoms or suspect you have a vitamin deficiency, please consult a qualified doctor or healthcare professional for accurate advice and diagnosis. Do not self-medicate or change your current treatment plan without your doctor's consent. Thank you for watching. I hope you found this helpful and enjoyable. Don't forget to follow for more, and I'll see you in the next one. Take care.